So guys, the need for more healthcare research in Ghana is evident. It's really evident, right? If we're thinking about it, with a massive and continuous exodus of healthcare staff out of Ghana to more developing countries, and with the limited health infrastructure in Ghana and access to healthcare we know can be very, very difficult, there is a need to think about how we can improve the healthcare system by doing more important and actually good quality research. So if you're thinking about it, there's lots of issues that are going on within the Ghana healthcare system. Communicable diseases that are out there, some of the non-communicable diseases, some of the issues that are going on with a changing in diet, a change in lifestyle. In addition to this, if you're thinking about the issues around maternal health and child health, and also the limited levels of digital literacy in terms of using and utilizing digital technologies to improve access to healthcare, then Ghana offers us a really important environment in which to do research. Right, guys, the government has made a lot of steps forward in terms of trying to improve the healthcare system. There's been a lot of funding that's gone in, which has done some good stuff, but actually, doing research in Ghana, particularly around healthcare, I think is a worthwhile endeavor. And that is why I decided to do one of my international research projects in Ghana. Hello, and welcome to another episode of Leading Health with Dr. Atom. Much appreciated. I'm always grateful for you guys connecting, for you guys engaging, and also exploring this episode. As you know, we're making videos every week. Subscribe. Today, guys, we are going to be exploring how you can do effective healthcare research in Ghana. So Ghana was the first country in Africa that I decided to do my healthcare research in. And it was one of the best places to actually do research. But there is always going to be some limitations. There's always going to be some problems. But, there were some really amazing people that I met, and they fully understood the power of international research, especially around healthcare. So what I want to do is to share my experience with you and to give you some key insights that you need to take on board if you're thinking about doing any type of research in Ghana. Let's get into it. Guys, the first point that you need to think about is how you navigate the power culture in Ghana. Ghana has a power culture, and so it's about thinking about the sort of centralization of power among sort of key individuals and dominant leaders. And they tend to make all of the decisions. So that's what we mean by a power culture. And when you get to Ghana, you're going to see it straight out of the airport. So this is something that you realize also happens within the sort of research landscape. And if you don't know the right people, you are. And so it's really important to understand the sort of clear chain of command. And also it's really important for you to go through the different hoops to try and get things done. There's going to be lots of hoops and you just have to jump through them. And one thing I know is that there's lots of gatekeepers and they have lots of keys, right? And sometimes they're going to give you the wrong key for the door that you want to open. Guys, get ready because it's going to happen and you just need to be persistent, okay? All right. The second point is that research in Ghana is really, really expensive. Doing good quality research in Ghana costs money, and you have lots of costs, a lot of which you probably didn't plan for, and that is normal. That's going to happen. You have to pay for absolutely everything. You always need to have cash ready to go because Ghana, cash is king. Try and get a receipt book. That's what I did. And what you'll find is, you can sort of keep note of all of the expenses. Trust me, you really need it. I actually got my receipt book. I purchased one from Amazon before I went to Ghana to do my research. And it was really helpful because I was able to track my spending. But that receipt book filled up really, really quickly. and the money just it just evaporates literally. So be ready to have at least 50% extra on top of whatever budget you've got in mind. Add 50% and then you're ready to go. The third point is about getting motivated workers, right? Ghana has really well-educated people. They're hardworking. They're ready to go. But you still need to provide them with the training. You still need to get that standardization mechanisms embedded within your methodology. Otherwise, things can go wrong. It's really important to monitor your RAs, your research assistants, just to make sure that they're doing the right thing and they're doing it in the right way. Trust me, guys, I learned this the hard way. I remember I had one RA, he did lots of patient interviews, but the only problem was he used the healthcare worker questions to interview patients. He just freestyled it, and, just basically did it the way he wanted to do it, right? When you're doing good quality international research, you can't do things like that. So, it was my fault. I didn't check it. We only checked it when we came to do the transcription. And you can imagine when I found out, that was a really bad day in the office. In the end, I had to pay another of my RAs to go back and do all of the interviews again. Obviously, that's money, that's time, that's stress, and you want to try and avoid that. So from my own personal experience, make sure you get that in order. The fourth key point is about ethical consideration, right? So when you're conducting healthcare research in Ghana, you're required to get lots of approvals and you have to follow all of the ethical guidance. That's something that I take really seriously. It's really important to do that. So as a researcher going to Ghana to do research, make sure that you have all of the informed consent. Make sure that you cover all of the bases, especially around things like confidentiality, making sure that, you have all the letters you need. And remember, Ghana is a power culture. I think I probably wrote more ethical letters to organizations in Ghana than I did in all of the other countries combined. Seriously, I was writing letters every day. But it paid off because once they get the letter and they think that, this is legitimate and, the research looks like something powerful, then people are willing to help you. People are really nice. So that's something that you should take into consideration. And guys, remember, it is a power culture. You're going to be jumping through hoops. You're going to have to be, making calls and getting disappointments and but doors will open. Play along. It's a long game, but if you're persistent, you'll get the powerful outcomes. So guys, the final point is about accessing, research participants. Ghana is quite a big country. There's lots of rural areas. So depending on the type of research you want to do, right, you're going to have to travel around. And when you're doing research face to face, the logistics of getting from point A to point B can be difficult. Trying to reach some of the participants, especially in the villages, there's going to be a language barrier and so forth and so on. So it's really important, I think, to recruit local people and they can help you to navigate this. One of the things that I did was to adapt my research to suit the landscape that I found myself in. And this was really, really helpful. And also what it does is it helps you to overcome a lot of those logistical problems. So when you're thinking about your methodology, guys, make sure you account for the geographical location that you want to do your research and make sure you have locals on board giving you advice, giving you insights, because you can't just turn up and think you know best. Trust me, you don't. The locals know best. They can give you the best advice and, you better take it because otherwise, you're going to have some interesting experiences. So guys, those are the 5 factors you need to take into consideration when you want to do good quality international research inside Ghana. As you know, I'm actively advocating for more people to come to Africa to do research, to interconnect. If you want to do research in Ghana, just, leave me a comment, contact me. I'm really happy to help you. Get in touch. I'll assist you in any way I can. I've been doing lots of research in Ghana. I'm doing my impact case study in Ghana as well. So I'm more than happy to help anyone that wants to help the Ghanaian healthcare system, wants to help improve research in Ghana. Get at me. Thank you as always for watching. Let's keep interconnecting.